Hi, I'm Lyle. I work for the digital department in NHS Lanarkshire, and I'm the transition manager, which is bringing in new technologies and innovations to the department.
Hi, my name's Laura and I'm the Digital Immunisation and Training Manager. I'm part of the digital training team, which consists of Carol, our team leader. We've got 9 trainers and we've got David, our training coordinator. We look after some of the training for the digital applications such as TrackCare, Morse, Clinical Portal, just to name a few.
COVID hit, we had the difficult task of mobilising the workforce to be able to work from home. So my team and a few others, that was a good thing about it. It was a real team effort. Everybody just pulled together and we deployed about 3,500 laptops to the staff to allow them to work from home and continue doing their jobs. And the ones that were going to work from home were actually helping us coordinate and make sure I had that opportunity to work from home. People were taking desktops at home and that, so then we had to make sure that we could get the remote access working so they could connect from home. So it was actually one of the biggest and time pressured mobilisations that we had to actually do. And it was, it was exciting. It was good to see that how people could actually come together in a crisis and deliver what we needed to deliver. And without kind of Laura and that being able to provide the training, then that was the kind of other side of the coin to help us deliver that. Being able to do it was actually, the COVID was a bad thing, as we know, but there was wee silver lining, and the way people did come together, and it was fabulous. It really was. It really was an achievement to be proud of. You had the rumours on the TV and things like that, but you see these things all the time, like with the weather, it's going to be terrible weather, and it's not as bad as you expect. This was the one thing that we had rumours about, that it was as bad as we expected, and it wasn't. You couldn't stop and think. People like Laura and Anne-Marie Robson and people like that were directing the traffic for us, telling us what we needed to do and where and doing plan. I'm not a planner, I'm a doer kind of thing, and without these guys planning it for us, we wouldn't have been able to achieve it. But some of the guys like Barry, Alan, Andrew, these in the deployment team, these guys were working crazy hours, just doing anything that was asked and getting the machines out there. There was one goal in mind: time had disappeared, all that kind of stuff. No, it was just get computers out there, get people work from home. We needed to keep the health service going. I think any corporation or size, it's difficult to bring in change. No know that as much as I do.
Yeah.
But when it's forced upon you, and then they see that in real time, it's easier to then adopt. And the kind of teams appeared out of nowhere overnight. Nobody actually know who ordered teams. It was there one day, and it fit the purpose of it. And the hybrid working and things like that for home, and that wasn't something I think we've got on our own. And again, it's not great to say that COVID done anything positive, but that is, I think, a positive change for Lanarkshire. We're a lot more dynamic across the organisation because these things were pushed upon us.
Yeah, and I think at the start of the pandemic, when we were all told to work from home, we then had been asked to learn how to use Teams and then obviously put that out to the staff and be able to train them how to use it because it was a new thing. We did our training face to face, so it was a complete change for us. We had to adopt and make sure that we were set up to continue providing the training because staff had to be trained, staff had to get logins for the applications out there. And at the time of the COVID-19 pandemic, staff were getting moved and drafted in to cover ward shifts, so they had to be trained in the system. So the team adapted very well to it. I think it was a complete, as Lyle says, it was an overnight thing where we had to change what we knew, getting people in a classroom, getting them trained. We had to then transfer that over to doing training online. So that's something that we never really done before. And also we had been used to maybe delivering webinars before, but nothing in the scale of what we needed to do.
Anne-Marie Robson, was kind of leading that a wee bit to get the digital visiting iPads, as we called them, and it was basically because obviously we couldn't visit loved ones in hospital, or people travel to visit loved ones, especially end of life and end of care, things like that. So we provided iPads to allow them to FaceTime each other, and it was, it's one of the things that we don't often get to experience, bringing families together. This was another bit about COVID that we didn't usually do was, you were patient facing and you were at the kind of hard end of that, it was people were as I say, end of life, they get to see their family one last time, or talk to their family, and the emotion in that moment. And you were providing that emotion. We're not trained to do that, so it's difficult not to get emotional in that. And it was good to be able to contribute to the human side of the NHS rather than just the kind of the machine side of it, where you're always kind of focused on corporate angles and technology and things like that. Sometimes it's nice to do the human side, and to get all the iPads out and allow them to do that again. It was something that happened overnight. You know, it was a kernel of an idea, and lots of people came together. There was never any questions. It was, this is our end goal, this needs to be done, let's push towards doing that, and then everybody just pushed in the same direction.
I think the feedback we got from one of the sites was that, you know, a family member sadly was put on end of life and the relatives lived abroad, and they said that because the iPads were in place they could actually communicate with their family member. So I think it does bring it down to reality. I think it just makes it realise that, you know, we do have a part to play in that kind of scenario. And the family were allowed to then communicate with their family member. If the iPads hadn't been in place, probably they wouldn't have had that opportunity. So it just made our job feel a wee bit more worthwhile, I think.